This is something that's near and dear to my heart because over 12 years ago, I went through 5 years of infertility, and thank God for that, because during that time I learned what I needed to do to get myself healthy to have a healthy son. And there, but for the grace of God and Sid Baker, who knows? So our canaries, what does that mean? I grew up in West Virginia, and we used to send canaries, well, not me, but, you know, the miners sent canaries into the coal mines. And if the canaries died, that meant the mine was too toxic. So all of our kids with autism, ADHD, chronic illnesses in general, allergies, asthma, are, in my opinion, our canaries. They are more sensitive to that which we're all exposed to. So yes, there's a genetic predisposition. All that means is that you are set up to have whatever it is you're going to have. But then there are environmental triggers, that tipping point, that straw that broke the camel's back, that last drop of water that then makes you express that which you're genetically set up to do. People have said it like genetics loads the gun, environment pulls the trigger. And so what do we see then? We see nutritional problems and infections and inflammation and immune dysregulation. And the other thing that's very important is something called epigenetics. And what that means is that all of these toxins and things in our environment that I'm going to talk about affect you mostly as moms, but also as dads, but affect you as moms and your genes. And so it will change your genes that you then pass on to your children. So that's what epigenetics really means. And that's something that is an emerging field of research and something that's really important. These things are epidemics, and genetics don't cause epidemics. So it infuriates me when we talk about how, you know, autism is a genetic disease and there's nothing we can do, or this is a genetic disease and there's nothing we can do. You don't get these kind of increases with genetic diseases. There's been a 6,000% increase over the past 20 years. 25 years ago, I taught kids with autism. It was incredibly rare then. It was 1 in 10,000. In 2001, it was 1 in 150. Now, in 2007, in New Jersey, it was 1 in 94 and 1 in 60 boys. That's incredible. But other things have increased also. ADHD, asthma, allergies, diabetes. All of these have seen tremendous increases over the last couple of decades. So, and everybody says, you know, when they look at statistics and they say, oh, that's just California. California doesn't count for the rest of the country. But it's not. It's all over the world. There are tremendous numbers. And in this country, what that means is that 12 new children every day, this was as of 2001, so the math's even worse than this, 1 new child every 2 hours is diagnosed with autism. So, this is one of my favorite quotes. Follow those who seek the truth, but flee from those who have found it. Anybody that says to you, I know what causes autism, for instance, run the other way. None of us know. There's a lot of information that still needs to be researched more. But we're looking. And what are the things that may be causing this sort of perfect storm? And these are the 4 things that I think are most important. Toxin proliferation. That's in our foods, in our environment. It's heavy metals, it's chemicals, it's hormones and antibiotics fed to our meat. It's chemicals in all our preservatives, in our medicines, in our vaccines, in our foods, everywhere. It's nutrition deterioration. That's not just all the processed foods. You know, all the processed foods, you know, when you see 10 or 20 ingredients on something, you know there's a lot of stuff in it. It's also talking about that we as human beings were meant to eat a rotating diet. We were meant to eat foods when they were harvested. We were not meant to eat red peppers every day of the year, or gluten and wheat every day of the year, or whatever it is. We were meant to have a rotating diet. We now, especially, you know, gluten, for instance, processed foods, all processed foods have gluten in them. That's the glue that holds that together. And so you see a tremendous amount of nutrition deterioration. I am not one of those people that think that vaccine causes autism, but there are certain conditions when you have that genetic predisposition that sets you up not to be able to handle either the live virus in the vaccine or the chemicals and preservatives that are meant to increase the shelf life of the vaccine. And we have gone from 3 vaccines in the, up into the toddler years to 34 to 37 vaccines in that period of time. And for a child who has problems with, and this is the last piece, the ability to detoxify, the ability to get things, efflux things out of their system, then getting that many with already a diet that's maybe deteriorated and all the other toxins in their environment, that child is not able to handle it. Does that make sense? Glutathione is the mother load molecule of our bodies, okay? And we call it the mother load because it's multitasking. It has so many things that it does. And we need glutathione to be able to detoxify. So if you think about glutathione sort of like this is a sulfur molecule that sticks off the side of it, okay? And think about when you cut a piece of garlic. Sulfur is in garlic and sulfur is sticky. So think about glutathione as sticking to that which you want to get rid of and get out of your body, okay? We now know through several different research studies that our kids with autism at least, and a smaller percentage of our kids with ADHD, have lower levels, a 72% decrease in good glutathione. They have what's called oxidized or bad glutathione, and that's where the 2 sulfur molecules are stuck together. So if your sticky parts are stuck together, it can't stick to that which you want to get rid of. So in my, dreams at night, one of the things I would love to see happen is have this glutathione added to the newborn heel prick. And the kids that have low levels of glutathione would be those kids that we give an alternative vaccination schedule to, that we make sure they're on double doses of probiotics when they have to get antibiotics, that we give them natural infection protocols and certain baseline things. And I think then that and what I'm going to be talking about, healing our moms, we'll see a big decrease in a lot of these chronic illnesses. But a lot of the things we talk about in giving ourselves or in giving our kids are things to make this pathway work better. The B vitamins, the magnesium, the zinc, the B12, the folate, that's all to make this pathway work better. And we'll talk about how you measure this. Glutathione itself is very, very hard to measure and very inaccurate. Most of the labs measure a total glutathione, which tells you absolutely nothing. That's a combination of the good and the bad. That doesn't tell you anything. So you can measure a cysteine level, or even in a regular lab you can measure a homocysteine level. And that tells you a lot. And can you go and lecture about it tomorrow? Okay, so, and these are all the things that glutathione does. It helps protect us against poor diet and pollution and drugs that we take and stress in our everyday lives and injuries and traumas and aging and infection. And it does all of these things. So this is the same sort of thing, just in words, of how glutathione is protecting us. And what this is about is it's not about any one thing. Why, everybody says, well, vaccines don't cause autism because now or mercury doesn't cause autism because now we've taken mercury out of the vaccines and there's still all this autism. Well, it never was just about mercury, and it killed me that we were saying that. This is multiple things, and this is a huge spectrum of kids with autism, with ADHD, with schizophrenia, with chronic illnesses, diabetes, asthma, allergies, and they're not all alike. And what may have triggered their illness may be very different. So it's what happens in the womb. It's what happens in early infancy. It's what happens in later infancy, possibly as late as toddlers. I've had kids that come at 5 and 6 and 7 presenting for the first time with autism. So it's all of those things. So in a picture form, our babies are exposed to what we take in. They're exposed to whatever vaccines we may get as a pregnant mother. They're exposed to mercury and other chemicals through the foods that we eat. Particularly the amount of fish has been studied. The other toxins in our diets and in our environment. The number of amalgams. It has been shown that there's a statistically significant increase in the incidence of autism when moms have greater than 6 silver fillings in their mouth. So All of these are factors. And in infancy, those same toxins, vaccines, and antibiotics. Antibiotics are necessary for many of our infections, but also they kill our good flora. Our bellies are full of trillions of germs. And not only do the antibiotics kill the germs they're supposed to be killing in the ear infection or sinus infection or pneumonia, they kill the good germs within our guts. And we have to protect against that. And then again, the same sort of thing, repeated infections, the foods, eating foods that we may be sensitive to. Kids crave that which they're most sensitive to. We all do. And all of those things are factors. So what I'm really so that's sort of setting the stage to what I'm really talking about, and that's how to make a healthy environment before you get pregnant, during your pregnancy, and then post-delivery to have the healthiest child that you can. There's no guarantees. As we said, there's a genetic predisposition, but I really believe that doing these things can make a huge difference. So what can we do? Big categories. Reduce and eliminate further exposure to toxins. Efflux existing toxins, getting them out of your system. And I'll go through each of these. And I like to think of things in the 3 R's, because that helps to categorize. I'm a big block-oriented person. So what do we need to remove? Do we have allergens? Are we allergic to some of the things that are in our environment, in our foods? Do we have germs? Do we have yeast or parasites? Do we have toxins? What is it that we need to replenish? Are we getting enough nutrients through our foods? Do we need to supplement? Do we have enough good germs, good flora? Do we need to add probiotics? And what do we need to repair? Are our bodies inflamed? Do we have an autoimmune disease? Are we not absorbing the nutrients that we're taking in because we have some kind of gut problem? Do we have a methylation problem? That goes back to that glutathione. Do we have depleted glutathione levels? So these are the things that we need to look at. So the first thing, preconception, is assessing your own health status. And you really need to look at your family history and also that of your spouse, and look at the first degree relatives. You know what I mean by that? Your brothers and sisters, any other children that you have, and look at what are the things that are affecting the other people in your family or yourself. Are there allergies? Are there GI issues? Is there Crohn's disease? Is there inflammatory bowel disease? Are there autoimmune diseases or psychiatric diseases in your immediate family that will increase your risk and your genetic predisposition to have problems for your child? Have you had to use frequent antibiotics? Have you had a lot of vaccines in your own history? Do you have infections? One of the infections we talk a lot about is yeast. Are you a woman or a man that has a lot of yeast? You know that because you may get yeast infections, you may get yeast vaginal infections, you may get yeast rash or have a white coated tongue, you may have a lot of mood swings, you may have very severe PMS. Those are often people that have high levels of yeast or candida or fungus. Bacteria, strep infections, repeated strep infections, Lyme disease, and that's something we'll talk about, as well as viruses and parasites. Dental amalgams. Do you have more than 6 silver fillings in your mouth? If you do, then I would highly recommend changing those to composite fillings at least 3 months, maybe even 6 months before you get pregnant. And we'll talk about that. Household and work environment. Are you a dental hygienist? Are you around a lot of that stuff? Do you work, or does your spouse work in a foundry? Do you have a very moldy environment? Do you work in a school that's very moldy? Those are the sort of things you need to look at. And then medication history. Oral contraceptives, for example, that you may have taken in the past will alter your zinc and copper ratio. And you may be depleted in zinc. And that's something that's very necessary, especially in men, for getting pregnant. Low zinc levels can cause male infertility, but also affecting the immune and detoxification systems in both parents. You also have to look at your habits. They're the usuals: nutrition and diet, smoking, alcohol, caffeine, exercise, sleep. Your immune system rejuvenates when you sleep. So are you getting good quality sleep? Are you getting into deep REM sleep? And if not, that's something you should really look at. And then non-essential habits. Do you expose yourself to chemicals and things like that in your lifestyle? And then based on your history, based on looking at those things, consider some testing. If you think you have infections, consider testing for those sort of things. If you think you have problems detoxifying because you've had a lot of exposures to vaccines or heavy metals or chemicals, look at your detoxification. As I said, you can measure a cysteine level through a specialty lab or a homocysteine level through a regular lab like Quest, LabCorp, etc. And you want to measure a cardiac homocysteine level, not a nutritional homocysteine level. Immune dysregulation. Do you have allergies? Is your immune system hyperstimulated? You're overly sensitive to anything. Or do you have immunodeficiency? You get more sick than everybody else. Or do you have autoimmunity? Your immune system is acting against yourself. Those are diseases like MS and lupus and PANDAS, which is pediatric autoimmune neurologic disorder associated with strep. Say that 10 times fast. Where your immune system is attacking you. Those are sort of things you have to test for. And mitochondrial function. The mitochondria are the energy cells of all of our bodies. And if you have very low tone, if you have very low energy levels, if you're constipated, you can look at thyroid, and you can also look at mitochondria. And these are things that you want to look at. And then heavy metals, as I've mentioned. Okay. Lyme disease in this area is out there. And I think it's something that we need to look at. It is a clinical diagnosis. It makes it very hard to diagnose in our children with autism because one of the categories of symptoms of Lyme disease is neurologic impairment. So you could say, well, everybody with autism has Lyme disease. That's where we get into a very kind of gray area, and one that I think we way overcall. But I think especially in our moms, we need to look at it because it can be asymptomatic for years, but at times of stress, like pregnancy, you can get a flare. And it has been shown that the Borrelia burgdorferi, the spirochetes that cause the most common form of Lyme disease, are found in breast milk. And it may not be just vector-borne. This is ongoing research, but it may be sexually transmitted, and it may be transmitted through your womb. A small number, in one study that was done, 240 out of 5,000 children had evidence of placental or umbilical cord or foreskin, after a circumcision, evidence of Lyme disease. So they had gotten the Lyme disease from their moms. So, what do we need to avoid? Okay? As one of my friends says, there's no such thing as junk food. It's either junk or it's food. So, as much as possible, avoiding the junks. Avoid the free sugars, the empty calories. Now, that's not to say when you're pregnant or even before conception that you're hunkering down for something that you should totally ignore that urge, because the stress of ignoring it may be greater than the problem of eating a little bit of it. But it does mean let's not do a bag of Doritos every day, sort of thing. Let's make some healthy choices. And certainly the artificial sweeteners, MSG, which is monosodium glutamate, dyes, preservatives, try to avoid as much as possible. So the more fresh and organic your diet can be, the better. The raw animal food and unpasteurized foods when you're pregnant and preconception is really just about the germs and possible bacterial infections. Unnecessary dental work, caffeine and alcohol, and food sensitivities, yours and those of your other children. If you have other children and you know they're sensitive already to gluten or to bananas and fennel foods or to eggs or whatever, you should avoid those in your pregnancy. This is something that has been researched and proven and is put out now by the allergy and immunology group of medical doctors, that especially if your other children have one of the big six, soy, milk, wheat, egg, corn, and nuts. Thank you. If your other children have one of those 6, that you, during your pregnancy and in the first couple of years of your child's life, especially when you're breastfeeding, and then for that child, you should avoid those foods. Instead of gluten, these are some other alternatives, and instead of casein, those are some other alternatives to consider. One of the things you don't want to do if you're avoiding milk and casein is to substitute soy, for many, many reasons, but one of the reasons is 50% of people that are sensitive to milk will also be sensitive to soy. So that's one thing you do not want to substitute. Avoiding toxins, and I'm going to list some of them here. Fluoride is a neurotoxin. And I think during pregnancy and in your child's early life, when they're not just brushing, they're swallowing the whole tube of toothpaste, you should use a non-fluoridated toothpaste. And I'll talk about some. My son likes Snappy Jaws, which you can get online now from Australia, because it's the only one that's not minty. So if you like the minty flavor, there's Spry and Biotine, and some of Tom's are non-fluoride. If you don't like the minty, Snappy Jaws is the way to go. Lead, old buildings, paint, if you live in an old building, old bathtubs, living within a mile of a major highway. Lead does not decay. So back in the 60s, when we still had leaded gasoline, the lead penetrated the soil, and that lead is still there because it doesn't decay. So these are things to look for in your own environment. Mercury. We talked about silver fillings. We talked about fish. The bigger the fish, the more likely it is to have mercury. Atlantic fish have more mercury than Pacific Northwest fish and more than New Zealand fish. So look at that. Many farm-raised fish still are contaminated, so that's not necessarily a better way to go. You have to really look at that. Most vaccines are now devoid of thimerosal or mercury. The flu vaccine, 93% of flu vaccines still have mercury, and the adult tetanus vaccine still has mercury, but the rest are pretty much devoid of it. Crematoriums, I know that's a weird one, but my friend Dan's sister, when she was pregnant, lived next to a crematorium, and the ash that is excreted from that is full of mercury. Arsenic is in pressure-treated wood like playground equipment and decks. It's also fed to chickens, non-organic chickens, and it's now in non-organic rice. So aluminum, nonstick cookware, and now that mercury is out of most of the vaccines, the aluminum levels are much, much higher. And then chemical exposures, flame retardants. Flame retardants, one of research study, again, out of Australia, looked at the causes of SIDS. And one of the theories is that with flame retardant clothes or mattress, bedding, that when a child pees on that flame retardant bedding, antimony is released. And in this particular study, they found high levels of antimony in the children that had passed away from SIDS. I recommend 100% cotton organic bedding and clothing. And then certain medications and herbs. One of the things we know is that Tylenol, acetaminophen, depletes glutathione. So just at the time when you may need that glutathione to detoxify you, when you get a vaccine, when you're sick, when your immune system is depleted, and you give Tylenol for that fever, that pain and discomfort, you are giving something that depletes your very ability to handle it. So for the most part, we recommend ibuprofen, Advil, Motrin, except when there's a risk of bleeding, like post-surgery. Most surgeons really don't want you to do that. But really consider not doing Tylenol, but rather doing ibuprofen. And then the flu shot or other unnecessary vaccines. The flu shot is now mandated for all pregnant women in the state of New Jersey. It is highly recommended for most pregnant women in the rest of the tri-state area. And I think we need to look at that mandate because most people do not necessarily need the flu shot. And I think we need to look at not what we in medicine look at is the public health. And we need to look, especially in our families that are most vulnerable, at the private individual. And is this flu shot necessary for that mother? And certainly if it is, it should be a thimerosal-free, and make sure you get that. But any other unnecessary vaccines, especially during... One of my favorite quotes, excellence is the result of caring more than others think is wise, risking more than others think is safe, dreaming more than others think is practical, and expecting more than others think is possible. The idea here is that now we get to this point in the talk and everybody's like, oh my God, really? But I think there are certain things that we can do and that we should do that are definitely possible, and can help us. Eliminating the toxins, filtering the water, using an air purifier or ionizer if you feel your environment is toxic, avoiding those plastics. On the bottom of the bottles, it will give you the number. Those are the plastics that I would highly recommend avoiding. Most have been taken out of baby bottles, for instance. If you look at the bottles, many baby bottles are now going back to glass. But look at it on your own, cups, plates, etc. And especially a plastic that's one of these you do not want to microwave. It's much better to microwave in glass if you're going to microwave. And important websites. These are very good websites about how to detoxify your environment, about how to reduce your risk, about how to check for lead if you're worried about that in your environment. So all of these. Scorecard is an excellent website that gives you what's in your area, not just in your home, but what's in your area. There's a study out of Texas several years ago by Dr. Palmer that looked at the rate of autism and special needs, and it was an exact correlation between the level of mercury and the level of autism, except in one county. And in that county, there had been an old foundry that had been shut down. So it really was an interesting correlation. They've shown similar things in Brick Township, New Jersey, in Silicon Valley. So that particular website gives you a lot of that information. So what do? We create a good foundation, whole and organic foods, a good prenatal vitamin. There are several out there. Optinatal is a very good prenatal vitamin. Nutritionist Choice is a very good prenatal vitamin, although you need to take a few of those a day to get enough. And if you're a pill swallower like me, that's not great. There's a lovely liquid multivitamin, which is what I take, called Intramax, if you're pill averse. But there are several good prenatal vitamins out there. Probiotics. Essential fatty acids, which is your good oils, extra folate, calcium, zinc, and iron are ones to particularly look at. And we'll look at all the nutrients in a few minutes. Regular exercise. Exercise is an excellent way to detoxify. When you sweat, you're effluxing toxins, both psychological, I think, as well as physical, out of your body. So regular exercise is very important. And then relaxation techniques that work for you, whether it be exercise or meditation or yoga or whatever it is also important. And sleep, as I mentioned before. Removing amalgams. Why? Each amalgam releases 17 micrograms of mercury daily, and that's mostly from chewing. And that is also absorbed into the womb. And there have been a few studies that have looked at the levels from amalgams. And as I said, there are now 3 studies out there that I know of looking at the increased incidence of autism related to the number of silver fillings that you have as a mother in your mouth at the time of pregnancy. We know now, and there are several warnings against fish consumption and too great a fish consumption. As I said, some of your fish like shark and swordfish are much higher in levels of mercury than some of your smaller fish. So limiting those during pregnancy. And then, as we talked about, where it can concentrate during gestation. So when and how, this is all in your handout, and doing it safely is important. If you just remove them, there can be some release of mercury into your system at that time. So you want to use a good palate saver that keeps the mercury from being absorbed into your system as the amalgam is being removed. You can go online and look at dentists that are doing this, if that's something. Usually, if you Google something like mercury-free dentist, you'll find dentists that will remove this safely. But these are just some guidelines in removing amalgams. Okay. Yeah.
Are there the composite fillings?
Yes.
Those, I've read that those also have certain.
They do. There's nothing 100% devoid of some amount of problems, but when you look at the risk-benefit, those are in general much safer.
So even if you're replacing like more than 6 fillings, you think, are there studies that show that those are safer?
There's not enough numbers yet that it's been looked at in enough numbers, in my opinion, but the general feeling is the lesser of the evils. So, okay. Then during pregnancy, the Spry biotin toothpaste that I had mentioned before, the sweetener substitutes, very good sweeteners, stevia, xylitol, agave are ones. Stevia is very, very sweet. If you're used to putting a teaspoon of sugar in your drink, you'll want to put a drop of stevia at most. Xylitol is an excellent antibacterial, as well as being a good sweetener. And you'll find it in a lot of products, toothpaste, gum, as well as in a powder form. There are nasal sprays, and then agave also. Alternative infection protocol. There are lots of ways to both keep yourself healthy at times of year like this when there's a lot of infections going around, as well as to get healthy, that include good antioxidants like vitamin C and vitamin A, that include good levels of zinc, as well as good antioxidants within your foods like carrots, etc. Things that can keep you healthy, and we'll talk about where you can find that. Ginger for nausea can be very, very helpful if you're dealing with morning sickness. Okay, so these are other things that your body's going through that you have to be conscious of, both calorically from protein needs. Your motility is decreasing in your gut. As we said, constipation can be very problematic. Your total calcium is low, but your ionized calcium usually remains unchanged. Lots of other changes that your body is going through during pregnancy. This is a study that was done looking at the typical doses of vitamins and minerals that are recommended during pregnancy and lactating women, and then what are considered the optimal dosages. And the multivitamins and things that we recommend really look at those optimal dosages. And again, in mothers and families that are at high risk, I would urge you to look at some of these optimal dosages when you're pregnant or lactating. Okay, replenishing probiotics. Probiotics, that's the good germs, okay? There are lots of ways to get that in from good foods. Vegetables, fermented vegetables, for instance, fermented cabbage, kombucha, and kefirs are very good forms of good probiotics. And certainly in taking a probiotic, you want to do it in conjunction with your doctor, so that, or your midwife or nurse midwife, so that you are doing adequate levels, but not overdoing it. There are some things where, we say a little is good and a lot is even better, and there are other things where a little is good and a lot can be more detrimental. But in general, having good flora is very, very important. There's some excellent research by William Parker looking at our biomes, which is our flora within our guts. And we have depleted that by such a great degree in post-industrial society that we are setting ourselves up for these chronic problems, and therefore, as I said, epigenetically often setting our children up also. So you're preventing overgrowth of certain germs, you're supporting digestion. Probiotics actually help to produce short-chain fatty acids, control inflammation, and may help to decrease infant allergies. There have been a couple of studies that have shown probiotic use in pregnant mothers as well as in the first 3 months of life decrease allergies at age 2 by over 50%. And that was a controlled blinded study looking at probiotics. Encourages peristalsis and moving. The 10 billion colony-forming units is a typical amount that is recommended. In some people, it may be a much greater amount that is necessary. Your probiotics need to be refrigerated, and they need to be of good quality. A non-refrigerated probiotic is not of good enough quality. Okay, iron. Very important for many enzymatic measures. Low levels have been shown much later in life. Low levels in the mom and in early infancy have been shown to decrease cognitive performance much later in life. Taking it with vitamin C boosts the absorption of iron. And one of the things I want to make clear when you look at these slides in your handout, is one of the best ways to get the good sources is through your diet. You know, I'm not sitting here telling you to take 20, 30 different supplements to get these things. Really look at what's in your diet, and getting good levels of things through your diet is the best way it's going to be absorbed as well as useful to you with all of these vitamins and minerals. Magnesium is very important in blood pressure control, in growth retardation. Folate, as we all know, is very important in decreasing neurotube defects as well as in DNA synthesis and repair. Green leafy vegetables are a great source of folate. Calcium, many women are deficient in calcium even before they get pregnant. And there are some decreases in calcium levels during pregnancy, especially your total calcium. Vitamin D is very important in absorbing your calcium. And we now know that at least 60 to 70% of kids in the autistic spectrum, as well as many of our neurotypical kids, are depleted of vitamin D. Part of the reason for that is we've now, lathered ourselves with sunscreen the minute we walk out the door. We're not getting the vitamin D exposure. So 20 minutes a day at a non-peak time of sun exposure is very important for everybody. And that includes during pregnancy as well as for your kids. It's very important for your bone health, for again, reducing preeclampsia. Deficiencies can result in poor sleep, and that's one of the things that's very important for good quality sleep. And there can be secondary deficiencies. Make sure if you're reducing your milk intake for whatever reasons, allergies, whatever, that you are getting enough calcium in your diet. And you can get calcium from lots of different sources. There's calcium added to orange juice these days. Look at the absorption, for instance, of calcium carbonate is very, very low. You're only absorbing a third of that which you take. But the taste is much better. Your calcium glycinate, your calcium citrate, the taste isn't as good, but your absorption is much closer to 100%. And in orange juice, for instance, it's calcium carbonate. So when it says you're getting 300 milligrams in an 8-ounce glass, you're really only getting about 100 milligrams in what you're absorbing. So look at your total amount. And very good sources, again, your green leafies as well as tofu. But don't overdo it on the soy. Selenium is very important for fetal growth, very important for detoxification. One study looking at selenium in decreased selenium levels in those kids with SIDS. Selenium is one of those that too much is not good, and you can get toxicity. Most of the doses of selenium are around 200 to maximum 400 micrograms per day, and certainly anything over 1,000 can be toxic. Zinc is also very important for enzyme function, for protein synthesis, for your immune function. There's a great zinc taste test, it's called the zinc tally. It's made by a company called Metagenics. And if you drink zinc, take just a couple of teaspoons, swish it around in your mouth, and swallow it. If you spit it out in my face because it tastes so terrible, then your zinc levels are probably fine. If you swallow it as if it's water, your zinc levels are probably deficient. And that's a very good, quick test for looking for deficiency in yourself or in your child. Again, zinc is one you don't want to take in excess, but a good multivitamin will have good levels of zinc as well as in some of these foods. Essential fatty acids are just that, essential. DHA is highest in breast milk. Many of our formulas are now fortified, but the absorption of our essential fatty acids from breast milk, as well as the amount of DHA, is much greater. Important for brain development, visual acuity. There have been studies that looked at maternal levels of DHA decreasing in the third trimester, and when you actually need increased levels. So DHA especially can be very important. You want to make sure that you have a pure product. This is coming from fish oil. If you have allergies to fish, it's something you should be very careful of, as well as looking that the product is pure, like Nordic Naturals, Carlson's. Those are pure products, and there are several others. And then DHA-rich eggs, if you're not allergic to those, is one way. And your small white fish will have some amount of essential fatty acids. Vitamin C is also important for your immune function. Vitamin A can be teratogenic in children, and certainly in the fetus if greater than 10,000 units are taken per day. So again, that's something you want to watch. You do not want all your essential fatty acids to come from cod liver oil. Cod liver oil has about 5 to 10,000, depending on the brand, of vitamin A in a tablespoon of cod liver oil. You never want to go above that, but you also have to look at all your other sources. So vitamin A is a very important antioxidant, very important for the immune system, but you do want to watch the dosages there. Vitamin E is important for cell-to-cell communication. Vitamin D we've already talked about a little bit, and the daily sun exposure is very important. And these are a lot of B vitamins. B vitamins are very important for synthesis of proteins as well as your gut function. Many people who have used chronic antibiotics, people that have gut disease, Crohn's disease, inflammatory bowel disease, will have decreased levels of B12 because they have decreased absorption from those inflamed areas or from antibiotic use. So be very careful of that, and that's something you should have checked. A B12 level is not accurate. A B12 level, if you measure that in your blood, looks at extracellular B12. What you're interested in is what's inside the cell. The way you measure that is through something called an MMA, methylmalonic acid. And that's a routine blood test you can get. And an MMA level, if high, means your B12 level intracellularly is low. If your MMA level is low, then your B12 level is fine. Other B vitamins, and I'm not going to go through all of these individually. Most of these are not something you need to take, except perhaps the B12 if you are low, but most of these are something you're going to find in a good multivitamin, a good prenatal multivitamin, and you're going to have good levels. And a prenatal multivitamin isn't bad to continue really for the rest of your life. And now what we're going to look at is not just the moms, but now the family and the kids. So what happens at delivery? As little medication and intervention as possible. Certainly anything that is of risk, anything that your OB or nurse midwife recommends, you want to have the information, but the risk-benefit has to be looked at. And anytime you or your fetus are at risk, whatever you need to do is important. There have been many studies looking at the increased rate of autism with fertility drugs, with drugs used during pregnancy, with drugs used during delivery. There's only been one study to date looking at an increased incidence with the use of Pitocin. And there have been some studies looking at the levels of oxytocin in children who got Pitocin, mothers who got Pitocin during delivery. Not saying not to do it. I had Pitocin myself. Again, it's a risk-benefit analysis, but make sure you are well informed prior to the time that you're delivering, as well as much as possible at that time. Okay. Pardon me? They are molecularly very similar. But there are several differences. But this is a study that's not a case-controlled study, but looking at the increased incidence of improvement with oxytocin in those children who got Pitocin. And then the second study was actually looking at the increased incidence of autism with Pitocin. One study, not saying that it is the be-all, end-all, but it is something to look at, and I think needs to be researched more. Hepatitis B, yeah.
Are there certain fertility drugs that are less bad, or are there some that you stay away from?
There have been none that have been shown with any increased incidence in any of the chronic illnesses, autism or ADHD. So I cannot say that, yes, you should avoid this one or this one. And there's been no studies that have really conclusively proven that any amount of fertility treatment, women who have gone through fertility treatment have an increased incidence of autism. That has not yet been proven, and I don't know that it ever will be. Yes?
Just anecdotally, in your practice, do you see a correlation between Pitocin and autism?
We're looking at it. We do see, oxytocin is something that has been used in people with Alzheimer's for many, many years. It increases word finding, it increases word retrieval, it's been found to decrease frustration and anxiety, and for that reason, a lot of the studies that are being done in autism started in other populations, like populations of people with Alzheimer's or Parkinson's, etc. And Dr. Baker is going to be talking about those commonalities in a couple of weeks here, actually, commonalities between those diseases. But that's where oxytocin started. Because of the very high frustration and anxiety levels in many of our kids, it was also started to be studied in autism. And there were two studies that came out at the beginning of 2010 that showed that oxytocin did decrease frustration, anxiety in children with autism and did increase word finding, word retrieval to a statistically significant fashion. The other thing that I found, it was the first thing that increased socialization. The first medication or supplement of any sort that was shown in a statistically significant way to increase socialization. So in a anecdotal fashion, we have looked at that, and in our practice, the kids that respond to oxytocin are more likely to have had Pitocin in the neonatal period. So that's all I can say about it right now, but it is something that I think needs to be studied more.
How many of the moms have not had Pitocin?
Many. Yeah.
Do you take their labor history as well?
We have a 30-page questionnaire, so we have every mom's labor, delivery, pregnancy history in our practice, yes. And all the kids, too. I mean, it's the whole shebang. Hepatitis B vaccine was a vaccine that was added in the early 90s at a time when the levels of autism started to skyrocket. I don't in any way believe that hepatitis B caused autism, but in kids that are susceptible, genetically predisposed, and do not have moms that are Hep B positive, it is wise, in my opinion, to delay the hepatitis B vaccine until their 2-month visit or later. In moms that are Hep B positive, absolutely they need to receive the baby needs to receive the hepatitis B vaccine. So most of you going in will know that long before your delivery. That's something that's measured. beginning breastfeeding as soon as possible after delivery. And even if you're not planning to breastfeed, that colostrum, that very rich immunogenic milk, is very important for your baby. And I strongly recommend breastfeeding at least for a few days, if not longer. Craniosacral therapy is a little bit like light touch massage. It's in the family of osteopathic medicine. And osteopaths and craniosacral therapists believe that we should do a process called cranial molding after a baby is born. And if you look at many other countries, both developing and developed countries, that is something that is done either by the mother or the doctor or the nurse midwife after birth. It's not something that we do here. In their opinion, the increased incidence of ear infections and sinusitis may be related to that lack of molding after birth. I don't have a particular stand on that, except that I do know that it's been very helpful to our kids that may have had birth trauma or had to go through a C-section for failure to progress, and it's certainly something to consider in the right hands. So if you're breastfeeding, continue all your pre-delivery lifestyle, as well as your prenatal vitamin. If you decide not to breastfeed and you have a family history of allergies, or you have a family history of gut disease or autoimmune disease or detoxification problems, then I would consider alternative formulas like pre-digested formulas, an elemental formula. None are, there's no magic bullet and there's no perfect supplement, milk substitute. But I would recommend, especially if it's an allergy or an autoimmune issue that you're concerned about, avoiding soy formulas. Breast is best, as I said. Studies have shown that there's an increase in one of the good flora, one of the good germs in the first year of life in children that have been breastfed. Delaying the introduction of solid foods. This has also been studied by the Academy of Allergy and Immunology, and now the American Academy of Pediatrics recommends that you delay until 6 months of age, not later than that, but until 6 months of age, the introduction of solids. And one of the things we do very early on is we often give rice or wheat-based products, and we want to look at the types of foods. One of the best first foods, in my opinion, is avocado. And that's an excellent first food, and babies love it. And you got an avocado right there. Just smush it up, and there's your baby food. Organic avocados, absolutely, absolutely. We'll get to that. I have that in a slightly later slide. And this is what I was referring to earlier, infants with a family history of atopy, allergies, who received a probiotic had a 50% decrease in atopy at 2 years of age. The maternal presence of low levels of omega-3, so low levels of that good oils, okay, and increased levels of omega-6, which are your more saturated fats, for instance, omega-6s, omega-9s, lead to increased inflammation. This has been very well studied, both in moms as well as in children. The flora that you get in your first 2 years of life is what sets the stage for the rest of your life. We as moms are passing on our germs as well as our genes. So our germ, our flora are very important to what our children's flora are set up as going forward. Early introduction of solid foods, especially grains and sugars, alters that flora. So when you give a sugar-laden food, when you give a grain-laden food, you're changing your germs, especially in the first 6 months of life. And early vaccination, especially vaccinations before 2 months of age and in a couple of studies before 4 months of age, stimulates the imbalance or dysregulation of your immune system and exacerbates the balance, the Th1 to Th2, makes you more likely to have to be set up for immune dysregulation and allergies. And this again is a study from the Allergy and Immunology division. So, waiting too long increases the incidence of allergies. Good options for first food, as I said, are avocado, and avoiding that which siblings or parents are sensitive to.
I just had a question regarding foods and allergies.
Yep.
I have some food allergies, so how concerned do I need to be that I'd be passing those same food allergies on? And
Those are foods that in your infant,
always have them.
yeah, it's foods that in the first couple of years of life, most allergists and immunologists would recommend you avoid in your child. And then after that, then you try them. Often when I'm trying a food that I'm allergic to, for instance, not me, but a mother is allergic to, I will first try it on the skin. Like let's say it's peanut butter even. Peanuts are in a category by themselves and you have to be very, very careful. But let's say it's almonds or whatever, put a little bit on the skin. And if you get a wheal and flare, a hive, then you don't want to give that particular food orally yet. When you wait 6 months, try it again. So that's another quick and dirty way to measure it. But I wouldn't do that in the first 2 years of life. I would avoid those foods. But if you have a lot of allergies and you're avoiding a lot of categories of foods particularly, you do want to make sure that you do that with either a physician or, in my opinion, a nutritionist or dietitian. Most of us in medical school, at least when I went to medical school, got a half an hour of nutrition training in 4 years of medical school. So we're not exactly your best agents for discussion of that. So if you're looking at your diet, you really want to look at that with somebody who knows what they're doing. Yeah. U of Penn, they were a little bit more out there even back then. Continue breastfeeding as long as possible. Okay, vaccines. As I said to you, I think in our kids that are most susceptible, we need to look at the individual rather than the public health and consider a modified schedule of vaccination, separating all vaccines in time. So that means rather than giving the DTaP, the IPV, the Hib, the Prevnar all at one time, give the Hib, a month later give the DTP, a month later give the Prevnar, or whatever it is you're deciding to give. There's an excellent book by Stephanie Cave who is a physician, family practitioner, that goes through what your doctor may not tell you about vaccination. That's the title of the book. And gives a vaccine schedule very similar to the one that ours is based on. Always use thimerosal-free vaccine, not because anything has been proven beyond a shadow of a doubt, but because it's just smart practice right now until we know. As I said, we're still looking for all the truths. We don't have all the information. But I would, in our babies, unless it is essential because of their individual problems, avoid flu shots. Support with antioxidants at any time you're giving vaccines for the few days before, the day of, and the few days after. Giving glutathione, for instance, giving vitamin C, giving vitamin A can be important and very helpful. Keeping children on nutrient-rich diets, and don't give vaccines to kids that are sick. It is so common. You go in for a sick visit, you have an ear infection, you go back for a recheck 10 days later, you're just finishing the antibiotic, you're just getting over the ear infection, and oh, by the way, you're a month late on your vaccine, let's give it right now while you're here. Oh yeah, that'll save me a trip. That's absolutely the wrong time to give vaccines. You want to give vaccines to your healthy child, and if your child is sick, hold off. And wait till they're free of illness, off the antibiotics for at least a week. I think that is one of the most important things that we can do. The other thing is there is a very good study on immunity that shows, and actually based on a meta-analysis, so many different studies that went into this, that 80% of children are immune to the diseases that we vaccinate them after their first set of vaccines. And that the booster doses that we give are only really necessary in that other 20%. So certainly if you have a family history of problems, if you have another child that's on the spectrum, if your child or another child has had problems with early vaccinations, consider checking titers, which means doing a blood test to prove immunity to those vaccines that you're due to get at kindergarten, for instance. And if your child is immune, they do not need that vaccination. You may have to get that blood test every year and keep proving that they're still immune. But many children, 80% of children, will be immune at that time. Okay. Environmental considerations, avoiding pesticides use. We talk about using a lot of pesticides on our lawns to keep the ticks away. It's been shown one of the best ways to keep ticks away is to put 3 feet of wood chips, this way, around the perimeter of your property. The vectors are more the mice than the deer, and you're keeping those away by putting the wood chips around your property. But avoiding pesticide use in general, avoiding wall-to-wall carpet, much more likely to get moldy, much more likely to have dust mites and mites in general. Using natural cleaning products as much as possible, and there are some very good websites for that also. When my husband at the time had leukemia and had to have a bone marrow transplant, we had to take several courses on how to cook, how to clean, all this kind of stuff. And the cleaning products that we routinely use are not allowed for transplant patients. We were at Fred Hutchinson in Seattle. And they taught us how to use green cleaning products. And we were using natural, and our babies are like a transplant patient. Their immune systems are just, a blank slate. They are just developing. So especially early on, using more natural cleaning products are important. After 3 months of age, especially if you're not breastfeeding, consider adding probiotics and essential fatty acid. Those are the 2 things, in addition to a good diet, that I think are essential for all of our kids. We have a diet, our American diet, that's very devoid of essential fatty acids. It's one of the reasons the Mediterranean diet is touted as a better diet, because it's much richer in good essential fatty acids. Okay. Exercise, activity, basic nutritional changes. Fresh, as unprocessed, unrefined as possible. Rotational. Very day to day or week to week. When I'd go to the store, I'd buy peanut butter one week, cashew butter the next week, almond butter the next week. I couldn't remember what I did day to day, but changing up what you're doing, not getting the same products all the time. And if you don't have it in your house, then your kids aren't going to be eating it all the time. Protein, every 4 to 5 hours. One of the things that I think we miss is our diets are very carb-laden in the morning and protein-laden later in the day. We're much better, and this is actually in Dr. Baker's book about metabolic syndrome. We're much better eating protein early in the day, breakfast and lunch, and saving our carbs for later in the day. So adding protein, whether it be through a protein powder or leftovers from the night before for breakfast, or a burrito or soup or whatever it is, getting protein in at breakfast is very important for cognitive function as well as your whole sleep-wake cycle. Vegetable juicing, you can't get vegetables in, juice them. Mix them into a muffin you're making, mix them into a meatball you're making. You can get vegetables in lots of different ways that are very important. And if you can't do everything organically, either financially or logistically or for whatever reason, these are the most important fruits and vegetables to eat organically. And I would add to that chicken and now rice. I would definitely recommend organically. Okay, so reducing and eliminating further toxins, effluxing as much as possible. And we talked about how to do that naturally. Exercise, sweating, pooping every day. We should all be pooping every day. I don't want to ask if you've pooped today, but if you haven't, then you really, 1 to 3 stools a day for all of us is very good for efflux of all of the chemicals, toxins, germs in our system. The natural infection protocol that I was talking about, antioxidants, anti-inflammatories. Garlic is an excellent anti-inflammatory. There are good products that are in the pill form, like Kyolic has one with parsley that cuts down on the regurg of garlic, but natural garlic. analgesics like compounded ibuprofen, fluids, baths are all part of a natural infection protocol. Reducing antibiotics use unless it's necessary. Certainly if your child has a strep infection, you have to treat it with antibiotics, in my opinion. If your child has a raging ear infection, you have to treat it with antibiotics. But 80% of ear infections are actually viral. And pediatric ear infections are actually viral. So that antibiotic you're giving is covering about 20% of your ear infections. So if we actually went in and tried to culture what was behind the middle ear, we'd find a lot more viruses that aren't going to respond to antibiotics. And then what I said before, the remove, replenish, and repair. And in our kids, reducing further toxins is the same as we talked about preconception. Those same things, whether our child is small or older. These are the things that we need to do. Correct constipation. Magnesium, especially magnesium citrate, is a very good cathartic, and that helps us to have normal stools every day. Vitamin C is also a very good cathartic, and you can use vitamin C until your stools get to be loose. And some of our kids need 500 milligrams, some need a couple thousand milligrams. It's excellent, emergency, those little packets of vitamin C that taste good. If your kids like fizzy drinks, that's a very good way to get the vitamin C in. Smooth Move tea, and what a name. But senna is a good natural way to correct constipation. Good hydration, fiber intake. That's mostly from your vegetables. You can add some psyllium or some pectin just in sprinkles to get good stooling. Maintaining alkalinity. One of the things you can add to a bath is baking soda and Epsom salts. That's another great way to detoxify. Some of our kids get worse after swimming. Even though swimming is so good for them, they get worse when they're exposed to chlorine. And just taking a spray bottle of Epsom salts and baking soda and putting like a quarter cup of each in a big spray bottle filled with water and spritzing them down before they take a shower or while they're taking a shower can be very helpful in decreasing that chlorine. Exercise to sweat, as I've mentioned several times. Two Roads Diverged, of course, Robert Frost is one of my favorite poets, and I took the one less traveled by, and that has made all the difference. These things can make a difference. They've made a tremendous difference in my life and in the lives of many of the families that we take care of, and in my opinion, definitely worth it. So what do? Heal the gut, avoiding what harms, avoiding allergens, additives, toxins, giving what heals, giving nutrients that you may need, probiotics, essential fatty acids, and fixing any underlying metabolic problems. And that may just be some additional vitamins or minerals that you may need. Curcumin is an excellent natural anti-inflammatory, just like garlic. There are commercial products like Enhansa. Curcumin is the active ingredient in the spice turmeric, which is an excellent anti-inflammatory. Again, in transplant patients, they use it topically to treat a lot of skin lesions and detoxification, mainly through sweat and stooling are the most important ways. So what is it that my child needs to get? This is another way of thinking about those 3 R's, and to get rid of. And it takes a lot of courage to even look at this stuff. I welcome you to look at our website. If you do, thanks to Betsy, please read our blog and like us on Facebook. I'm trying to get into the 21st century, so we are doing that. For those of you who are looking to get pregnant, who are pregnant, my partner, Dr. Gail Sakis, sees adults. She is an internist, and will be happy to work with you in planning or continuing a healthy pregnancy along with your OB or other practitioners. And then another thing you may want to consider, we are also hosting a healing retreat for parents dealing with chronic illness of any kind and looking at all of the things in our lifestyles that are important. Looking at our homes, our ways of healing ourselves, the feng shui of our lives, as well as the medical and biomedical interventions. And this is the first weekend in June down in a retreat center called Canoga Lake outside of Asheville, North Carolina. The food will be all organic, can be gluten-free and casein-free if you need it. A beautiful place to hike and swim and relax, as well as learn how to take care of yourselves as well as your kids. So, keep your faith in all beautiful things, and the sun is when it is hidden, and in the spring when it is gone. It's one of my favorite pictures. So, questions?
I feel like I'm a pretty healthy person, but my husband is not.
Yep.
So I'm wondering how much of this will be beneficial for him, do you think? You know what I mean?
Yep. And I think if you're planning a pregnancy, if that's where you are, I think it's very important for both potential parents to look at that. Because, for instance, zinc levels can definitely affect fertility. And the healthier he gets, the healthier his genes are going to be. I mean, certainly your health is much more important, in my opinion, to the health of the baby, but we can't totally discard the men. We need them sometimes. So, a consultation to at least look at some of those things.
Even like the fillings and things like that. I mean, any of that?
That doesn't make as much difference.
Okay.
No. But really looking at why does he have this bad health? Does he have some allergies? Does he have some immune system or detoxification problems? And looking at that, and it will not only help him to be healthier if he chooses to be, but also help you to know what your child may be more likely to be dealing with. So.
In the context of everything we've talked about, what there's a higher ratio of boys versus girls
Yeah.
that are affected by autism.
Yeah.
How is that just the genetics? Is that the thought?
It's partly the genetics. I mean, I always joke that, poor guys are the weaker sex, but, they, without that extra X chromosome. And there is a lot of research looking at that. But it's also partly that glutathione, because there are changes when your glutathione pathway is messed up and your methylation and sulfation pathways are messed up. It has been shown that you have increased testosterone levels. And so you as somebody, and this is not proven yet, but one of the theories is you as somebody who may have a depleted glutathione may be more likely to produce a boy than a girl. Not proven, theorized, looked at by a couple of people, but it has been shown in children with autism that those children do have higher testosterone levels and sometimes lower estrogen levels. So it is something that is a factor. But that's an area where there's a lot of research that still needs to be done and a lot of controversy as to the real reasons why. So, yeah.
Do you advocate a woman or even a man before the pregnancy begins to do like a DMSA challenge to see if you want to chelate and if they're going to respond to chelation? I mean, you really want to get the heavy metals out of it.
I think, we've talked about this a lot with the group of physicians and researchers that I've worked with over the last 12 years. And I think we were once asked, what's the most important biomarkers? And for me, the most important is history and physical. Top 10. And so you need to first look at your individual history as to what your risk is for those problems. And then I recommend looking at a couple of different tests, for instance, a porphyrin test, to look at as a guide, not as a be-all, end-all, but as a guide as to what your risk for heavy metal burden or exposure may be. And then look at your red blood cell levels of your metals. Not your blood levels, but looking at the red blood cells. Again, those can be normal if your exposure isn't ongoing, and I recommend looking at that. If your risk is high because of any of those things being positive, then that's certainly in conjunction with a physician that I would look at many months before conceiving. But not for all comers, in my opinion. So. Absolutely. Yeah.
Question about the probiotics.
Yeah.
Breastfeeding.
If you're what?
If you're breastfeeding and
Yeah.
taking probiotics yourself, do you still recommend supplementing directly with?
You don't usually have to, no. You really, as long as you're taking adequate levels and you're stooling every day, you should be, your baby should be absolutely fine. Other questions? Yep.
Where do you get oxytocin
Um,
for the kids?
from a pharmacy. We order it. No, there are two forms: nasal spray, which you have to be able to coordinate the sniff and spritz, and topical cream. The nasal spray is definitely preferable and more effective than the cream, although we have seen some cases of efficacy with the cream also.
Are there any personal care products that, like deodorant that contains aluminum, that you should be avoiding? What's the story?
It's an excellent question. There certainly are theories out there that the use of aluminum deodorants increases the risk of breast cancer. I think, again, the more natural products that you can use, the better. But you have to look at all the factors for yourself. I mean, some of the body odor that is, the natural deodorants don't get the odor. They really don't. They'll decrease the underarm sweat, and perspiration, but they really don't help the odor. But I believe that if you're looking at your body and your body is really healthy, you don't have much of an underarm odor, except at times of stress. So, again, like with the cleaning products, using more natural products is, in general, preferable. That's never been looked at in pregnant women or in fetuses or in children, though, as far as the effect of that. There's only a couple studies looking at breast cancer.
I have a question about calcium, because you spoke
Yep.
about the importance of calcium. Do you see kids, like I've read some things about the calcium channel thing, and I just know I have kids who really do not do well on calcium.
Yep.
Do you see that, and what do you recommend with their investigations?
Well, there's a lot of theories out there about oxalates and the effect of calcium on increasing oxalates. It may be those children that have problems with high oxalates that are responding negatively to the calcium. The other thing I'd look at is it's very important to look at your calcium to magnesium ratio. And if you're taking calcium, you also need to be taking magnesium. And it should be in about a 2-to-1 ratio. So some of the kids that don't respond well are not getting enough magnesium. And then the third thing is your vitamin D. And if you're taking a lot of calcium but you're not absorbing it because you don't have adequate vitamin D levels, you may get an increase in your extracellular calcium and then a problem. So I do recommend checking calcium levels. Your most accurate is an ionized calcium, as opposed to just a regular blood calcium. And certainly in the kids where that is high, those are kids who won't respond well to taking extra calcium. And then you have to really look at it through dietary sources. And broccoli is a very good source of calcium. I've got one kid that eats a bunch a day, and that's how he gets she gets her calcium, through broccoli. So most of our kids won't eat enough to get enough calcium that way.
Just not really scientific and no pun intended, but like a gut feel. Are our kids in general? Beth Lambert uses the term compromised generation, but are our kids getting sicker? Are kids in general?
Absolutely. You walked in just a little bit late, and that's how I started all of this. And if you, let's see, I mean, I grew up in West Virginia, and you send canaries into the coal mines, and if the canaries die, then the mine's too toxic. Our kids with autism are our canaries, and I know Beth very well, and this is what we're talking about. That this is the compromised generation, and it's not just about the genetics. It's about this whole toxin proliferation, and these four things together. And because our kids have very low levels of glutathione, they are more susceptible. So what I was saying early on is that this is something I would love to measure in the newborn heel prick. and measure whether a child is depleted of reduced glutathione, good glutathione. And if they are, those are children who are much more susceptible to multiple vaccinations, toxin proliferation, nutrition deterioration, and should be treated much differently. But yes.
So the numbers of children you're seeing are greater, but also on average the children themselves are sicker.
This generation, absolutely. Absolutely. No question in my mind. And it's not, the rates of autism, and autism is just the tip of the iceberg. The rates of all of these things have increased astronomically. And there are multiple factors. It's not, and that also is something I was saying, it's the multiple hit hypothesis.
I believe me,
yeah.
That's where Kirby and Robert Kennedy Jr. got in trouble. They
exactly.
Everything
on Mercury.
And
right.
They don't. Unfortunately,
and it's it's the whale watch. It's the this is the thing, and we all look for that magic answer. Well, if we find out that it's this one thing, then we can do something about it. It's not.
That's the problem with all these studies. The person that's always quoting, asking about studies, it doesn't take these factors into account. They even talk about vaccines. Well, every vaccine is lot dependent. It's a biologic agent grown in eggs, for example, a flu vaccine, and they use different adjuvants, and no two lots are exactly the same.
Exactly.
You're comparing apples, oranges, grapes, pomegranates, and the same thing, even pitressin. Well, what's the dosage they're given and for how long?
Right. It's not been studied.
Between people walking in to the labor and delivery and getting pitressin right away versus trying it natural for a while. Where are those numbers?
Right. Right, and it's not been studied. We just don't have that information. And part of the problem in autism is that we take all kids with autism and do these studies. And when you do a study looking at the effects of the gluten-free, casein-free diet on every kid that walks in the door, so you're randomizing it. So you're taking the next 100 kids that walk in the door and putting them on a gluten-free, casein-free diet. You're going to have, it's not going to be a statistically significant number. You're going to have a study that shows that gluten and casein do not make a difference in autism symptoms.
Anyone that has got problems from that study.
Right.
And those are kids
that are most likely to have problems. So you've got to look at the subsets. You've got to first look at your history and your physical exam and look at what is this kid. Is this an immune kid? Is this a gut kid? Is this a detox kid? Is this a mitochondrial kid? Is this an autoimmune pandas kid? Or is it a kid that has 3 or 4 of these things? And then you have to subset them, and then you study that group for those treatments. And then you look at in a randomized, controlled way. The other problem with randomized studies is our parents don't want to be in the placebo group. I mean, we did a study many years ago of B12. And we looked at it was a placebo-controlled, double-blind study, crossover study, looking at subcutaneous B12 versus intranasal B12 versus placebo. And then you crossed over after 6 weeks to the other group. Everybody that was in the subcutaneous B12 arm that moved to the placebo arm dropped out of the study because they had seen improvements with the subcutaneous B12 and then lost them when they went to the placebo. And they knew it, and they didn't want to wait. They didn't want to watch their child regress. And so that's the problem we have with trying to do the really good studies. Because, it is, whether you're talking about therapeutically or you're talking about medically, there is a window when things will work better, faster. It's not to say that you can't help a kid that's 8 or 9 or 17, but in that really neurodevelopmental window in the first few years of life, the more you do, the better. Which is why I like to give these lectures to physicians, because I think that if we did more early intervention, both diagnosing and intervening even before we diagnose, that we would be much, much better off. And if any of you saw Oz's show a few weeks ago with everybody talking about what causes autism, the only guy, in my opinion, that sort of stood out is somebody I trained. It's now he has been and is a regular pediatrician that gets it, and is now doing studies within his own practice of the use of all of these things, essential fatty acids, probiotics, measuring these kids in susceptible families, and seeing differences in the kids starting very, very early in life. So
what's his doctor? Is that you talking about?
Mike Gabriel. He's in
I have a question.
Staten Island.
If you are pregnant and you have an autoimmune at the time of pregnancy, is there anything much more important than the others that you should do?
Well, I think if you have an autoimmune disease, you've really got to look at your immune system and what are you reacting against? What is your autoimmune disease based on? And then looking at how you can better support your immune system, naturally or otherwise, to be the healthiest that you can be. So yes, and it includes good gut health and anti-inflammatories that are safe, and as well as looking at specific reasons for the autoimmune problem.
So would you have testing done?
Yes.
You would tell that person to do some testing?
Yes. Yes.
You're talking about let us suggest us take organic chicken.
Mm-hmm.
I'm asking about they have all like the natural chicken.
Mm-hmm.
What's different?
If it's certified organic, then you're sure that there's antibiotics not put in it, that they're naturally grass-fed, that the arsenic isn't fed to them, that sort of thing. If they're not organic, it may be for several reasons. For instance, I belong to a co-op of local farmers, and they weren't organic because they were too small a farm to go through the certification process. But they didn't use pesticides, they didn't use hormones or antibiotics in their chickens, and so that would be listed as a natural, or hormone-free, antibiotic-free, but wouldn't get the organic certification. So it's about knowledge. It's about knowing where it comes from more than anything else. And what you do is you have a brand that you're looking at. You go on their website and you look. I wouldn't trust Purdue's natural chicken, but there are others. Bell and Evans, those sort of things that may be absolutely fine. Does that answer your question?
I just have two questions. One, I didn't see milk on your list for organic food. Is that not as important? Because that's one that I've always...
some of us sometimes call milk cow pus. So you have to look first. I guess why it wasn't listed is because it is one of the top 6 allergenic foods. So first of all, you have to look at, are you having milk at all? Or are you doing a milk substitute? A potato milk, a hemp milk, a coconut milk, an almond milk. Many of those milks have just as much calcium and protein as a glass of cow's milk. Okay? If you don't have an allergy, if you don't have a problem with it, and your first-degree relatives don't, and you're having milk, then yes, I do recommend that your milk is organic. So I'm sorry I didn't mention that. I guess my life is so devoid of milk, I don't even think about it as something to list. So.
And then my second question is, I've heard this a number of times from different doctors that your baby, when you're pregnant, your baby takes the nutrients they need. And so my question is that true? This sounds kind of funny, but if that's the case, is the prenatal vitamin really for the mom, or is it really doing anything?
You're going to feed your baby before you feed you. But the more depleted you are, the less that is available for your infant. And that sort of goes to this slide that I had of what's recommended for pregnant and lactating women versus what, in my opinion, is optimal, and what is most likely to help you and your developing fetus. So that's what that's...
B12, for instance,
right. You
but
do have a very... Is that what you said?
But I've always been worried about taking extra supplements while I'm pregnant because it seems
you should do it in conjunction. Yeah, you should do it in conjunction with your physician. But if your actual intracellular B12 level is low, then your baby's B12 level is going to be low also, intracellularly. So that's something that you should look at and discuss with your physician. Pardon me?
So would you recommend having the baby tested for B12 levels after they're born?
Sure. An MMA, an intracellular B12 at some point in time.
But a lot of people do say that to take oral B12 is a waste because
Absolutely.
Like what
Absolutely.
percent is absorbed is so variable. You should really take it intranasal
Yeah.
or.
I should say that, most, if you have problems with,
Injections while I'm pregnant, so
pardon me?
It won't do injections while you're pregnant, typically, and my doctor won't.
Okay.
So, and then supplements don't increase it for me.
Right. Your oral, if your B12 levels are low, your absorption of B12 is going to be very low, your gastrointestinal absorption. So taking it orally will not raise your levels. It's been shown in lots of different categories of people. So looking at intranasal B12, subcutaneous B12, and transdermal B12 in conjunction with your doctor, I think is important. And you need to talk to your physician about it in those other forms. If it's not subcutaneous, then transdermal or intranasal. I mean, intranasal is certainly preferable to transdermal. There's been no studies that looked at the actual absorption of transdermal. So, other questions? Yeah.
The heel prick test that you
Mm-hmm.
is clear an idea. Is it something that a pediatrician could actually ask for the test, or no? It's not.
You can't do an accurate glutathione level. Dr. Shakis and I, along with another physician, measured split sample levels, so looking at accuracy of all the different types of specialty tests, as well as a lot of regular labs. And glutathione is one that did not pass muster. So you can't, except in a research setting, get an accurate glutathione level. So you can measure cysteine. So looking at that pathway, it's not available right now, except in a research setting, right? But what you can measure is a cysteine level. So this right here,
Cysteine is low.
then the glutathione is most likely low, right? And that's from a specialty lab that you measure a cysteine. If you want to measure it in a regular lab, like your LabCorp or something like that, you can measure a homocysteine level, and you get a cardiac homocysteine level, not a nutritional homocysteine level. But that'll, as you can see, you will see if, and this is the most likely part of the pathway that becomes deficient. And we know that our percentage, at least half of our kids on the autistic spectrum have low homocysteine levels. And so in those kids, you'll see that low homocysteine, and that's a way to measure it. You can also look genetically, the MTHFR, both the C677T as well as the other one. I can never remember all the letters and numbers. But anyway, that sets you up to have lower glutathione levels, and that's something you can measure. But those are not be-all, end-alls. You're still going to miss some of these kids who may still have low levels. So your cysteine, in my opinion, if you can get it, it's only $40, is the most accurate way to look at your glutathione levels because it's farther down in the pathway. So, do you have a question? You look like you have another question.
No.
Oh, okay. All right. Okay. Yeah.
What lab do you use to measure this?
The most accurate is Genova. Okay. Any other questions, comments, suggestions? Okay. You're welcome to go to our website. You're welcome to, if you'd like any of the articles or any of the research behind it, please feel free to email me and we'll get that to you. It's about 20 pages of articles. So.
If a lot of these things, are driven by financial motivations, like, say, some of the studies about vaccines and what the studies actually show and how the data is skewed and such, and if you believe there's financial incentives, I think right now, if you look at what's happening in the states going broke and the number of kids with special needs, that there's going to be a major paradigm shift because no one can afford to take care of these kids anymore. And that, in fact, financial considerations, maybe it's the wrong reason, but it's really going to force things to change and people to take a good look and stop dilly-dallying around. I don't know if you had any thoughts about that.
I mean, autism and all chronic illness are putting a tremendous strain on